gave local and state public health jurisdictions some options for how to decrease the burden of quarantine, right? So as COVID-19 circulates more widely, more people are being diagnosed with COVID-19 and are being isolated, and as a result, more people are being identified as close contacts to someone with COVID-19 and are required to quarantine. So there's general interest to try and decrease the impact and the burden that quarantine has for people that are close contacts to someone else with COVID-19. And so the CDC released some guidance yesterday highlighting some options. Now, just to be clear, nothing has changed with this virus, with this novel coronavirus, right? We still believe that if someone is exposed to COVID-19, they can develop or could develop infection themselves, COVID-19 disease, anywhere between 2 to 14 days after an exposure. That's the reason why there has been this 14-day quarantine. Nothing has changed with that. There's still the possibility that somebody who's exposed to the virus can develop COVID-19 within 2 to 14 days after exposure. The question, though, is what is the risk with decreasing the quarantine period? So going from requiring somebody to stay at home out of the public spaces after an exposure for 14 days versus going down to 10 days versus going down to 7 days if somebody gets a test. And so that the CDC did some modeling around this and looked at various options to assess the risk of post-quarantine transmission. So the risk that somebody would go on and spread it to other people if they ended the quarantine at 10 days versus 7 days with a test out option. And with each step down in quarantine time period, there is some increased risk of a person with COVID-19 being missed and spreading it to others. But that risk is relatively minimal when you talk about going from a 14-day to a 10-day quarantine. But the risk goes up even further if you're looking at a 7-day quarantine, even if there's a test required to get out of quarantine for 7 days.
I mean, are you confident that the drop to 10 days is a good idea for us right now?
There was no requirement that New Hampshire adopt these different strategies. We assessed the information, the data that the CDC put out. We've actually been discussing, we've been aware of this guidance coming out now for a week or two, a little over a week, and so we've actually, public health agencies around the country have been discussing this planned guidance rollout with the CDC for the last week. And we've been expressing our concerns and getting clarifications on how the CDC came to these numbers. So even though and people can go and look at the CDC guidance themselves, but even though there might be some small increased risk going from a 14-day quarantine to a 10-day quarantine, we felt that the overall benefit of reducing the burden of quarantine on people was favorable to go from 14 days to 10 days.